Do you have a young developing athlete that has knee pain or heel pain? Okay, so we always see a lot of this, all right? But I do feel there's a little bit of an uptick in terms of how many young developing athletes we're seeing with it at the moment. So if your child has pain around this part of their knee, let's get Matthew in here, all right? So around this part of the knee, or if they have a little protrusion, so a little bit of a bigger bone or swelling around that area. Same goes in the heel, right round here, just there. If they have some pain in this area, then it might be they have something called Osgood-Schlatter's disease, which is in here. Forget about the disease, don't be worried, it's not that scary. And Sever's disease at the heel. So essentially all that is there's a lot of pulling going on there. So as they're growing and they're doing a lot of sports or physical activity, there's a lot of pulling going on at the growth plate, all right? So the growth plate is here and here on the heel. Essentially, that's where the bone is maturing and growing when they're going through those kind of those years of development. And if they are doing a lot of exercise, sometimes that can irritate that growth plate, and that's why they get that swelling, that little bony prominence, and the pain, more importantly, when they're exercising, okay? Now, a lot of people panic about this, and don't get me wrong, this isn't something to be ignored, but it's not something to worry about. It's not necessarily going to cause long-term problems. But what it does do is it indicates that there's a problem with the amount of workload that they're doing and their body's ability to cope with that. So what we have to do is just swap around, move things around, maybe reduce a few certain sessions here and there just to try and help the body recover and reduce that pain level. We can also supplement with strength and mobility exercises. So that's where we come in to assist with this. So if you do have a young athlete with these type of issues, absolutely go and see a physio. But the big problem we've got at the moment is that we have a lot of clubs, representative stuff, school stuff, kids that are moving into adult sport as well. So we've got a bit of a recipe for disaster because all this is happening and the demands on them are really high at a time when they actually need to be not protected, but we need to be looking after them in some respect and balancing the strength and mobility needs with the amount of sport that they're playing. It's great that they're active, but we want to make sure that they're able to continue to do that and actually realize their potential. So if you've got a youngster with these type of issues, get it checked out. There's loads of stuff we can do, but don't panic.